The tumor is located at segment 8. Our plan of surgery is a segment 8 segmentectomy. We plan to start the operation at the root of the middle hepatic vein. The transaction direction is cephalo to caudal direction, starting at the root of the middle hepatic vein and along the middle hepatic vein. After that, we will identify the vein of segment 5 that is usually located above the hilar plate. So, if we find the hepatic vein of segment 5, we will perform parenchymal transection to the anterior section and identify the anterior portal pedicle and control the portal pedicle of segment 8. After that, intravenous injection of ICG is performed to identify the true anatomy of segment 8. Finally, ICG-guided parenchymal transection is performed. This is the port placement position. The procedure was started with mobilization of the liver and identification of the hepatic vein groove. Partial mobilization of the right lobe of the liver was performed. Cholecystectomy was done to expose the right portal pedicle. Dissection to identify right hepatic artery and right portal vein was performed. Inflow control of right lobe liver was done to identify a demarcation line. Preparing to perform the Pringle maneuver was done by encircling the hepatoduodenal ligament. The Pringle maneuver was performed by the intermittent technique. Parenchymal transection was started at the root of the middle hepatic vein. The direction of transection was cephalo to caudal, along the middle hepatic vein. The hepatic vein of segment 5 was identified. After the hepatic vein of segment 5 was found, parenchymal transection was performed at the anterior section of the liver to identify the right anterior portal pedicle. Parenchymal transection was performed along the right anterior pedicle to identify the segment 8 pedicle. Then, the pedicle of segment 8 was controlled. Intravenous ICG was injected into the patient to identify the true anatomy of segment 8. Clipping and transection of the segment 8 pedicle were done. ICG-guided parenchymal transection was performed. The right hepatic vein was identified. Clipping and transection of the hepatic vein of segment 8 were done. Parenchymal transection was completed.